Welcome to Body Solutions, where total physical fitness is directed by physical therapists. Today I'm going to talk about a common injury, probably the most common that we see. It's tendinitis. Now you can have tendinitis in your elbow, in the outside, the inside. You could have tendinitis in your shoulder, commonly known as the rotator cuff tendons. You can have tendinitis in your hip, your knee, your ankle, around the Achilles. Typically a tendinitis is just overuse. You've used the muscle so frequently, so continuously over a period of time that it started to pull on that tendon so much where it caused inflammation. Now the beauty of tendinitis is it's pretty easy to address. When you first experience it, if it's only been a week, maybe 2 weeks, you just want to do some light stretching to guide the healing process. Again, you're pulling tension to the muscles and through the tendon, not to get more flexibility, but to guide the healing, because that tension tells the cells how to heal and where to heal. Now you can also do some light ice if it just happened, but if it's been kind of chronic, you want to use heat. Heat will bring blood flow and healing nutrients to the area, and that will accelerate the healing process. And after the period of stretching and some heat or some ice, and you feel pretty good, you want to follow that up with some good strengthening to help rebuild the tendon strength and the muscle strength. However, if you're having tendinitis that's been lasting for weeks and weeks, you want to get that addressed as soon as possible. The longer the inflammation has been there, the tougher it is to treat. So some simple physical therapy for a few weeks, typically to address a fresh tendinitis, very easy. Once it's been in there for a month, 2 months, and maybe even 3 months, now it's much harder to treat. Okay, so I encourage you to come in to go to any physical therapist that you know and get the tendinitis addressed. Make sure you try to address it before the 3-month mark. If you've already had a pain somewhere in the joint or the tendons for more than 3 months, it may have turned into what's called a tendinosis. You want to refer to our tendinosis page to read all about it. It's a much tougher problem to treat, and that diagnosis unfortunately typically takes 4 to 6 months of you working on it to make it 100%. So again, try to avoid it becoming a tendinosis and getting your tendinitis addressed as soon as possible, either by yourself through stretching, that should take care of it, or seeking some medical professional help.